Hello, my name is Andrew Murphy. I'm a general practitioner at Turlough Moor Health Centre, and I'm also a professor of general practice at NUI Galway. I'm talking to you today about the work that I do, which involves research. I think it's really important that research is done in general practice. 90% of all contacts with patients occur in general practice, so it's really important that we are using high quality evidence to ensure that the care that patients receive is the right care at the right time to the right patient. A very common thing that we see in general practice is urinary tract infections. Most females will experience at least one urinary tract infection or bladder infection during the course of their lifetime. Some experience a lot more than that. We generally use antibiotics for the treatment of that. However, as you know, in the world today, there's a big problem about resistance. The antibiotics that we have are a limited number of antibiotics. We're not developing any newer ones. And those that we have, unfortunately, the organisms or the bacteria are beginning to develop resistance to them. That means, for instance, in my own practice in Turlough Moor, one of the most common drugs called trimethoprim, we can no longer use in routine care because too many patients are resistant to it. So we've done quite a bit of work at NUI Galway looking at how can we try and improve the care given to patients with urinary tract infections. We've looked at the quantity of antibiotics and we've looked at the type of antibiotics. A very interesting new area that's developing, however, is whether urinary tract infections don't need an antibiotic in the first place. I should say that these are urinary tract infections that are what we call in medicine uncomplicated. That means that the patients are reasonably well with them. They don't have high temperatures or pain in their sides or anything like that. So these are the simple, uncomplicated urinary tract infections. I'm really interested in seeing if we provide anti-inflammatory drugs to patients, that would be drugs like Brufen, can that help patients get back as quickly as they would if they were given an antibiotic or not? How can you help? We need over 400 patients to participate in this study. We need patients who are over the age of 18 years. There's no upper limit at all in age. And importantly, patients need to have a smartphone. The reason for the smartphone is to cut down on the work required of patients so that there will be no questionnaires to fill up, no paperwork to do. Patients will simply get a pop-up on their phone for a number of days with a small number of questions that patients can answer. So we really hope that you will consider participating in this study, which is funded by the Health Research Board to answer an important and common question looking at Irish patients, but we do think that it will be of interest to international audiences as well. Many thanks indeed.